Per the introduction, my name is Ryan Mavin. I'm the Director of Enterprise Architecture at ACT Health, and I've been lucky enough to have led the implementation of GS1 standards across the ACT Health public system over recent years. It is my pleasure today to share the success ACT Health's collaboration with GS1 has enabled during this time. For anyone not familiar with the Australian geography, the Australian Capital Territory is located in the southeastern area of the Australian mainland, and it's surrounded by New South Wales, so a relatively small area. Across the ACT's two major tertiary facilities, the emergency departments, our rehabilitation hospitals, walk-in centres and other health facilities, we do have a lot of clinical and non-clinical locations that we need to keep track of. Fun fact, the Canberra Hospital has the second busiest helipad in Australia. I know this because I live a block away from the campus, so very first-hand knowledge of that one. My team get called upon for design direction whenever new ideas arise, and a key part of that is connecting the project teams with those ideas, with the standards that will enable a desired change. And our philosophy of implementing standards every chance we get has served us well. And by solving today's problems and enabling tomorrow's innovation, we really mean that when we use standards to solve an immediate problem, we do this knowing established implementation standards are the building blocks that will enable us to do more value-added activities that we may not have even thought of yet. And I think this resonates with what Jose was saying before around the standards being implemented at the ground level. You do this as a starting point rather than just as an afterthought. So in terms of unique location identification and following on from that philosophy, deploying unique location labels across ACT Health has demonstrated using the standards for inventory management that has then enabled other opportunities. We did start small. The beginning, for several years, we managed with just a handful of global location numbers, and they were allocated to our major facilities delivery docs for delivery purposes. The more we looked at automating processes, however, the more fragmented and conflicting location information we found across our systems. We needed to establish a master list of locations with allocated unique location identifiers, and we needed to link those to the related systems to actually have the decent traceability through the systems. Using the GS1 standards meant we could be confident that our identifiers would never conflict with any other locations anywhere in the world. And it also meant we had access to excellent documentation, and we had the benefit or the value-added benefit of being able to publish those locations for our third-party partners to work with as well. I don't know if anyone's had much to do with software development in their own experiences, but having fantastically documented standards is a massive benefit in that space. Now, understanding the physical hierarchy of our locations was one of the things we had to sort out pretty quickly, and it was pretty straightforward for us. We have campuses or sites, which was the first level of location that we were tracking. Those sites have buildings, which was the second level. Those buildings have floors, a third level. And then within those floors, we have rooms or areas, which was our fourth level. And then at the end of that hierarchy, we have sub-rooms and bins and storage for various stock that we would be tracking. The GS1 global location numbers were the right standard for the locations that we needed to be for meaningful external party consumption. And then the global location number extensions, that's an extension of...
You can't see the...
I'll keep going. That is an extension of the global location number standards, was appropriate for all of the sub-locations that we were more concerned around for internal usage and primarily internal staff. This meant that allocating GLNs down to the building floor level was the right level for us, and our extensions were for anything more granular. We did go with RFID capable labels for future proofing. So the screenshot or the photo you see in the slide at the moment is an RFID enabled barcode label. This was again keeping with our philosophy of implementing the standards today to enable tomorrow's innovation. And while the barcode scanning meets today's requirements, we remain excited about the possibilities for automated identification data capture using RFID in the future. Sorry, just bear with me a moment. We are in the process of deploying the labels to all of our locations across our facility, across the territory, and we're doing this in alignment with our digital health record program. We're in the process of auditing where all the assets are, medical devices and things, and we're using that engagement with the clinical areas to minimise disruption and deploy the location standards as part of that process. These location numbers will be synchronised into our territory-wide supply chain management system as soon as or shortly after the digital health program goes live. Now, we do realise that this will yield benefits, and knowing what stock we have, where and when, and streamlining our supply chain level management processes is the key benefit that we will drive out of that. All right, some of the more exciting things that we do want to realise from leveraging these standards are really around helping people get to where they need to be, as well as just the stocks and products that we're tracking. So I've got a wards person's example listed up there, and it's a really good case because wards people in a hospital, the ones in our main Canberra hospital, they can walk up to 20 kilometres a day in moving patients and walking between jobs. And by linking wards person jobs to unique location codes, we can electronically capture that the ward person has arrived at the location and notify clinical staff to take appropriate actions. And furthermore, when the job is complete, other jobs in the vicinity of the location can be allocated to reduce the time walking between jobs. So there's just these little value-add activities that actually make a massive difference to organisational efficiency. So ACT consider ourselves lucky to have had a long-standing and well-established relationship with GS1, and knowing that GS1 would answer the call when we reached out meant that we were ready to move quickly when COVID-19 pandemic hit. So when the pandemic started, legislation was passed that mandated all businesses needed to provide details of their patrons' attendance, and clipboards, paper, pen arrived everywhere. I'm sure we all saw this in our travels in our own areas. This raised security concerns among the community members and also presented a new source of infection with physically handling pens and papers. I have no doubt that if we had, as a nation, stayed with paper and pen tracking, we would be in a much worse place today. What we saw was lots of third-party web applications popping up that had enabled the businesses to have their patrons scan a QR code and enter their attendance online. However, some of these solutions sought to capture customer data as a revenue source, and none of the solutions met the public trust expectations, nor could these solutions guarantee a service level for getting that contact tracing information for attendances back to the public health parties that were responsible for contact tracing. ACT Health already had an established internal software development capability, and our CIO, Peter O'Halloran, saw the opportunity and we jumped on it. In our first design meeting, I asked the question, what established standards can we leverage to make this work? And with our contact tracing being all about people and physical locations, the GS1 standards were the obvious choice. The initial thinking was that if cafes, restaurants, galleries, sporting facilities, and any other locations we had to keep track of already had registered global location numbers, that we wouldn't need to reinvent the wheel, and that would have been amazing. We called Kath from GS1, and Kath's fantastic. She always has an answer, always knows where to find an answer. I had hoped that we would find some good information, and Kath confirmed that New Zealand were already starting to use GS1 QR codes with global location numbers specifically for this purpose. So we were very happy about that. I had hoped that all of the businesses that the ACT Health, within ACT Health would have already registered their global location numbers for supply chain tracking. That would have been fantastic. But sadly, we're not quite there yet. So still maintain that vision. It'd be great if we can get to that point at some stage, but we had to work with what we had. As much as I would have loved to pitch global location number registration with GS1 to every business in the ACT, it's not that big an area. We did have to choose our battles. So given the number of locations, also, it wasn't practical for us to work within the GLN range that we had already been allocated. And that was one of the first things we thought about. Can we use that same GLN range? But Kath and the team did help us with allocating new blocks of 10,000 global location numbers that we could use specifically for the purposes of contact tracing, which was very convenient and remains to be very convenient. While this was all happening, we set about developing a consumer app that could scan the location codes and enable the contact tracing. All right, so soon after that, the Check in Canberra application was launched. We built tools that enabled the businesses and community members to register their locations online, and those tools automatically allocated the next available global location number and then generated the GS1 QR code posters that contain the location ID. Once this was proven in the ACT, our next step was to collaborate with our health peers in other jurisdictions, with GS1 providing the unique location number ranges and practical guidance on their application. This soon led to the launch of the Check-in Queensland app, the Check-in Tasmania app, and the Territory Check-in app. We had a bit of an argument about that one because we're the ACT, the Australian Capital Territory, and they're the Northern Territory. So Territory Check-in was what they went with, but it was all good fun, and it's been a fantastic collaboration with those health parties. The interoperability enabled by the GS1 standards allowed people from currently enables people from across the 2 states and territories to use the one app from their home state to check into locations across the other states. And that's really what we're aiming for in terms of that interoperability. One of the great things about the GS1 QR code is that it enables to not only include the global location number, it includes the website address component as well. The website component is different for each of the states and territories that we're working with, and that enabled the application to easily identify which back-end services it had to communicate with to determine if this was a valid location and where to push that contact attendance detail. And now, to ensure the public trust was maintained, we put strict controls in place to ensure that check-in records could only be released to public health people under very strict circumstances that were relevant for COVID tracing, which is very important for information security, and that all check-in data is permanently deleted after 28 days, because after that point in time, it's not relevant for contact tracing anymore, and it could only be, there's no value in keeping it any further. The unique location identifiers provided an unambiguous key against which we can track and trace people at risk of COVID-19 exposure, and then we can quickly alert them so that they can quarantine immediately. And this is really where the trade-off of this solution comes in. That's the key that we're trying to achieve here. Now, this has proven to be a very valuable tool in protecting the community against COVID-19, and it's easy for the patrons to use, it's easy for the businesses to use, and it works. Now, in keeping it as simple as possible, we really improve compliance. The Australian community has overwhelmingly tried to do the right thing during this pandemic, and providing them tools to effective tools and easy to use tools is the least we can do to try to help them keep doing the right thing. With the check-in apps, the GS1 standards have played a major role in making checking in easy and unambiguous, and the interoperability the standards have enabled has meant that a significant number of people have benefited across the 4 states and territories and counting. So I would like to close by making a call to action. There has been amazing work done by everyone across Australia in response to the pandemic, and we're always looking for ways to learn from that experience. And I believe there's a key lesson here that we can take away from the check-in experience. So by reducing the time that people are infectious in the community, we reduce the spread and we save lives. This also shortens the lockdown and border restrictions, which saves livelihoods. If we all use the same GS1 unique location standards with consistent naming linked to accurate geocoding data, how much more effective could we be at informing the community about the COVID-19 exposure sites? COVID-19 won't be the last pandemic, so let's all get on board. Thank you.